Hi, I am Dr. Anantha Krishna. I am a practicing surgical gastroenterologist at Nano Hospitals, Uttarahalli. So coming to one of the most common problems that we see in the population, it is called as piles or hemorrhoids in the medical terminology. So what happens in piles? The patient might notice some bleeding in stools, which most often is painless bleeding. There are drops of blood that come after the patient passes stools. So what happens if they don't treat that? These piles can become bigger and bigger, and at one fine day it might need to be operated to be treated. So when should the patient consult any physician or a doctor? So the first occurrence of blood in the stools, when the patient notices, without hesitation the patient has to meet preferably a surgeon, so that the surgeon can examine and decide whether this needs to be operated. Does piles need to be always operated for it to be treated? No. There are various conservative management for piles. In the initial stages, if it is shown, then a few medicines can help strengthen up these blood vessels in the area where the patient passes motions, so that these piles will spontaneously regress, and the surgeon will also advise the patient to take adequate medications so as to ensure that patient will not be having any hard stools or straining during stools. This will prevent progression of the piles to a stage wherein it has to be operated. Suppose the patient has come a little late and it has to be treated by surgical means. We have a plethora of surgical treatments. So one of the treatments is called as hemorrhoidectomy or open surgery. So wherein the pile mass is surgically ligated. Due to recent advances, we also do what we call as a laser hemorrhoidectomy. So in this, we just pass a high frequency laser energy, so which will burn the blood vessels that are causing these pile masses. So the advantages of these laser hemorrhoidectomy is that it is relatively pain free and can be done as a daycare procedure for the patients.